Tracy Game is our resident expert on the Medicare Shared Savings Program. That is the MSSP.
Hi, Dan.
Good morning, Tracy. What are the most important changes you think for the Medicare Shared Savings Plan for 2024?
Well, Dan, there are three that I would point out that people need to be aware of. First is Medicare refused to postpone the sunset of the web interface. 2024 is still the last year for that reporting. Second, Medicare introduced the new Medicare CQMs to address the concerns of ACOs about the transition from web interface to a registry reporting. And third, they finalized but postponed until 2025 a requirement that 100% of advanced APM participants use CERT, that all APM participants, MIPS, QP, and partial QPs, submit and be scored on PI, with the usual automatic MIPS exclusions applying.
So, Tracy, how have the APP options changed?
ACOs can still use the web interface for 2024. Starting in 2024, Medicare CQMs are an option along with the previously established eCQMs and MIPS CQMs. There is still a favorable quality standard in 2024 for those submitting MIPS CQMs or eCQMs.
So that doesn't apply, we think, to the Medicare CQMs.
That's correct.
So how are the Medicare CQMs specified? What are they?
They share their MIPS CQM specifications. They require the assistance of a qualified registry. They cannot be done as eCQMs. The numerator, which is the performance, specifications are identical to MIPS CQMs. The denominator differs from MIPS CQMs. With the Medicare CQMs, it's not all patients, all payer. It's limited to Medicare Part B, fee for service patients, but it only includes patients seen by a primary care provider.
It sounds like a little like what we used to do in PQRS, but limited to the primary care patients in the ACO.
That's correct.
So, Tracy, are the patients who are eligible for Medicare CQMs the same patients that are on an ACO's assignment list?
No, it's all patients seen by a primary care provider participating in the ACO. There should be overlap between the assigned and eligible population, but you can have assigned themselves prospectively to an ACO primary care provider that did not have a primary care visit in the ACO. And the submission will include patients who were seen at least once by a primary care provider, but were either self assigned as a patient of a different ACO or were assigned by the plurality of care rules to a different ACO.
So, I think what you're saying is that it doesn't matter who they're assigned to. If they were seen by a primary care provider in the ACO, they'll be included in the report. And if they weren't seen, they're not going to be included.
That's correct.
I think I've got it. Now, how is this better for ACOs? How is the Medicare CQMs better for ACOs than the MIPS CQMs?
Three things I think. It should be easier to deduplicate the smaller set of patients. Medicare promises to help by providing a quarterly list of eligible Medicare patients. It also, if an ACO needs to resort to chart abstraction for some of its practices in order to meet data completeness, it's a smaller set of charts that will need to be abstracted. Less time for them devoted to having to pull patient charts to report this data.
Makes sense. I get it can be a big help, I think. Now, does a practice submitting Medicare CQMs have to use Medicare's provided list?
No, not at all. Medicare's provided patient list is only a guide. The gold standard for determination of the denominator for Medicare CQMs is still practice claims data.
Tell us more about the CEHRT requirements that are changing for APMs that you alluded to in the first question.
So, yeah, it has been postponed until 2025. Starting in 2025, all advanced APM participants are required to use a CERT. All APM participants will be required to make a promoting interoperability submission. Promoting interoperability requirements will be the same as for MIPS, including the applicability of exceptions and options for reporting, including individual, group, and APM.
Great, thank you. And I understand the assignment methodology has been adjusted. What's changed?
There's a third step now to assignment, but for those patients who are still assigned in the two steps as they currently exist, There's an additional 1 year look back for patients who saw a primary care physician in the prior year, but not in the current year, and saw a non physician practitioner in the practice in the current year.
So it sounds like they get 2 years now to see a primary care physician in the practice, but have to be renewed by at least either the physician or one of the non-physician practitioners to be assigned in that third step.
That is correct, Dan.
Well, thank you, Tracy. You've been a big help.